Hi, we're at the International Workshop for Chronic Lymphocytic Leukemia in New York, and today is the Young Investigator Meeting, which is a day traditionally before the full workshop. I'm Constantine Tam from the Peter MacCallum Cancer Center in Melbourne, and I'm here with my good friend Dr. Dr Davids from the Dana-Farber, and we're here to talk about pursuing a career in as a young investigator in CLL. So perhaps I'll start with you, Matt. How did you get started in this field?
Yeah, so I was interested in hematology as a trainee, as a fellow, and I went into a laboratory that was studying apoptosis, cell death, a very basic process, and just by happenstance we were getting a lot of patient samples from CLL patients. They have a lot of lymphocytes circulating in the bloodstream, and it was very easy to get cells. So I started finding some interesting things in the laboratory, started to get involved in the clinical side as well, and really enjoyed taking care of these patients. And so I kind of tried to fuse the two together and enter the field at that point. And actually one of my first introductions to this field was the Young Investigator Meeting, 2010, I believe it was, in Cologne, Germany, and really opened my eyes to the larger CLL community, which is really an incredible group.
Yes, indeed.
Yeah.
So, Matt, one of the real successes that you have came to date is the development of venetoclax, or ABT-199. So perhaps would you like to expand more on the story of how you got to where you are?
Sure, yeah. I think venetoclax is an incredible drug that we have available to us now, but its roots really go back to a lot of the science that was developed over decades by scientists at places like Dana-Farber and other places, and some of the creative scientists at Abbott Pharmaceuticals who devised the drug. I sort of credit myself at being in the right place at the right time, and also having good mentorship. So I was working with Anthony Latai, who had done a lot of the early work with ABT-199 and the earlier molecules in the laboratory side. I was working with Jennifer Brown, also at Dana-Farber. And so when it came time to run the first in-human phase 1 study, I had developed some of the laboratory expertise in the drug. And Dr. Brown was generous enough to let me run with the study as my very first trial that I was running with. So I think that highlights the importance of good mentorship. And I was very well supported in the early phases of developing that drug. And I think it's been an incredible collaboration with your group in Australia, who's also done very important work with developing venetoclax. And it's great to see it now finally available for patients.
Yes, and indeed, I think that the one good thing about our community is how we can form really very close international collaborations. I first met you, of course, through the work on venetoclax, and we share a number of common interests since then. I guess for a trainee out there thinking, how do I get into CLL research? How do I get into this sort of where we are? You mentioned, what sort of advice would you give them? You mentioned mentorship, but maybe it's just some career advice from someone who's been there?
Yeah, so I think that in a sense it's a little bit harder now to get into CLL. When we started, it was a less crowded field, there was less going on. But I would actually still really encourage people to get into the CLL field because we can't cure the disease yet for most patients. And in fact, in some ways, this may even be a more exciting time to get into the field. Before when we started, we didn't really have the tools in the arsenal to really attack this other than chemotherapy. And now we have all of these targeted therapies that we can now put together in creative ways. And I think both on the laboratory side, we need to develop the preclinical science to inform the trial designs, and then we need good clinical investigators to run the trials and take care of the patients. So I think it's actually a great time to be getting into CLL research.
And maybe this is a good time to talk about the different areas that people can be in, because there are the pure clinicians like myself, who is a clinical investigator, and then people who are in the laboratory, and then the people who do both like you, and what the pluses and minuses of each step is. So, I mean, speaking for myself as a clinical investigator, my days are spent seeing patients, covering the clinical results. Is satisfying because there's a lot of patient care, and it's what we're used to during medical school. However, it does lack that. It means that you don't have the ability to go and investigate your own findings. If you make a finding in the clinic, you have to find a basic science collaborator like yourself to do those experiments to prove your clinical observations.
Yeah. So I think this is a process that people kind of come to over time. It's not something you might know as a medical student, but I think as you go through your training and you're exposed to laboratory science and clinical work, I think you do have to, in some sense, make some choices. And I think it's important to think about where your skill set is best used, where you can make the biggest impact. And for some people, that's really purely focusing on the laboratory side. For others, it's really in the clinic and with clinical trials. And then some like me try to do both, which can be challenging. And so you need to have enough funding to have protected time to do that. And so applying for grants early, I think, is an important thing because, as you know, when you get very busy with patients, it can be hard to have time to even apply for grants, and you can kind of get stuck in that position if you want to be more on the basic research side. So I always encourage trainees early on to think about grant opportunities, to have some protected time. And I know there are differences in terms of the United States versus Europe and the availability of those funds. So that can be challenging as well sometimes. But I think having the protected time to focus on the laboratory effort really allows you to be successful in that. And it's always a challenge.
So can I ask, in your case, at which stage of your career did you apply for and got your first grant?
Yeah, so for us, we could do usually the 3 years of our residency program and then typically a 3-year fellowship program. And in our fellowship program, we were lucky to have 2 years of that time protected for research. Right. And that was the time period where I was able to apply for my first grant, which was a Career Development Award from Leukemia and Lymphoma Society in the United States. And that allowed me to have time to then pursue additional grant opportunities through other organizations and also internal funding from my institution.
So your advice to fellows out there is that even during a fellowship year, start looking for grants because that's going to be a breach to your further research.
I totally agree with that, and also be prepared to be rejected. I mean, I think I applied for 10 grants the first time and got one of them, so it's a lot of rejections along the way. You have to be a little bit strong with that. Same thing goes with manuscripts as well. Not to be discouraged with early failures because often you get good feedback on the grants and the papers and you can make them better and reapply, so it's important.
So I guess, Matt, I just want to say, it's as you say, it's an exciting time to do CLL, but there's a lot of choices for people out there. So I guess, what do you think? What do you think that people should enter our field and become investigators in CLL?
Yeah, I mean, as I said, I think that this is a really particularly exciting time where we have all these new tools available, and and some people will say, well, maybe we should move on to other diseases. We have enough effective therapies for CLL. I would actually say the opposite. Now's the time to put the pedal to the metal, so to speak, and really push for curative strategies especially for our younger, fitter patients, and for our older patients, really just well-tolerated treatments that they can be on long term. I think we need help. We need young recruits to help come do that.
Yeah, and from my point of view, I think that CLL is actually a model disease, isn't it? It's a disease where you can easily sample the tumor in the blood, and it's a disease that has taught us a lot of things about cancer in general. Right. We can analyze the genetics and the evolution very easily, and what we learn from CLL is probably going to be translated across the entire field of cancer. Right. So I would say that yes, a lot of progress is made in this disease, but the progress has been made because it's a disease that is easy to sample, and we can develop targeted therapy based on those sampling. And this is where the successes will continue to be. And our successes will probably likely translate to a lot of advances in other fields in cancer. So I would encourage any people out there to continue to help us because it's a really exciting field to be in.